Hello, I'm Rebecca Giusti. I'm an associate professor and a clinician from Western University in Pomona, California. And I'm the chair of the Neuromusculoskeletal Medicine and Osteopathic Manipulative Medicine department there. The topic of my presentation was thoracic outlet syndrome and some of the clinical correlates along with this and what we can do with manual medicine to help this with this syndrome. The definition of thoracic outlet syndrome is very complex. It's very multifactorial. Of course, you have the two types. You have the vascular and the neurogenic, but most of the time, the neurogenic component is what we call disputed, and it's from many different etiologies. So it's really the job of the clinician to try to determine the etiology and then to provide the proper treatment to that syndrome to help relieve the symptoms. There, unfortunately, are really no tests that are pathognomonic for thoracic outlet syndrome. There are some, especially the elevated arm stress test and then the upper limb extension that have a little bit better sensitivity. So you can put a lot of tests together that might lead you towards this diagnosis, but there is not one real definitive test to determine if this is thoracic outlet syndrome. So right now it's very exciting. There's a lot of emerging evidence about microperfusion. So we're looking at now the area in the lymphatic system within the cranium is getting more and more established. But yet the area of the meninges has been very much woefully understudied. But now what we're finding is that there are lymphatic vessels within the spinal meninges with both the dorsal and ventral aspect converging out to the dorsal root ganglion close to the facet joint. They're also hooking into the epidural lymphatic vessels, which are going out into the periphery. And there's also lymphatic vessels that are now being found in the vertebrae themselves, as well as the intervertebral discs. So it's giving us a lot of information about immunoregulation and also about osseous repair. And it's very exciting because we might be able to have a chance to influence these systems that interplay with our manipulation. So how can we interplay with this? How can we influence the lymphatic drainage to better promote both the immune response and also possibly to help prevent certain things like spondylolysis, for example. So there's many different ways to interface with the lymphatics of the system. We have the lymphatic vessels of the skin, which we can also work with. We also can interplay with this with just a little bit of oscillation. So if you are palpating, for example, a counterstrain point, you may actually be able to feel the fluid motion within the lymphatic vessels themselves. If you keep a very soft pressure, and you may be able to use this kind of very slight oscillation to almost encourage the fluid to where you feel it is going. This tends to have almost an immediate response under the tissues. You feel this softening, this increased compliance. A lot of times that tissue resistance that you might have felt releases. And it seems to make the counterstrain process go by a little bit faster. Normally we would hold for 90 seconds, but this actually seems to help this move along much faster. Once you add that little oscillation, encourage that fluid motion, you feel a lot of softening. And it seems that now the point is resolved. You slowly bring the patient back to the neutral position and retest. So it's tapping into that lymphatic system or that vascular system, if you will. This is being taught by Dr. Ed Gehring. It's also being taught by Dr. Ken Lossing at different courses. Dr. Ken Lossing has taught before for the American Academy of Osteopathy, the AAO, and Dr. Gehring holds many courses and also internationally as well. So these would be the two places where I'd say if you wanted to get a little bit more experience with this type of palpation and this level of palpation, these would be two very good places to start.